We're here today with Dr. Chrissy Stamm. So how is your experience being the initial franchisee of Health Atlas?
It has been awesome. I can only say it has exceeded my expectations, and we've barely started. So for the first time, I feel like I have a lot of hope about where the practice can go, and that I don't feel like I'm like a hamster on a wheel just trying to figure things out on my own, but that I have like a team and a support and people who are doing it now and doing it well behind me. And there's been so many corrections that we've found that we've been able to plug a lot of holes that were like sinking the ship beforehand that weren't even things I thought would happen with Health Atlas. So that's been an extra added bonus, and I feel lucky that I got to be first one.
That's awesome. And then how hard and difficult was it finding an MD and, helping, like how did the franchisors help you find staff and such?
It was actually pretty easy to find the MD. They set it up with a headhunter, so that we had great candidates right off the bat without a lot of energy or time, anything on my part. All I had to do was meet with them. The Health Atlas doctors came and helped me with the interviews so that I could get it, and then I did a couple on my own, but they helped make the decision, and I feel good about who we have, and so yeah, it was easy.
That's awesome.
Finding the medical doctor.
Good. And what improvements have you seen statistic-wise as far as your office improving and with your staff and keeping track and managing by key metrics?
Well, we didn't really keep track all that much before. I mean, we did some stats, but in general, this is a lot more specific. It's good to see people were more motivated. Like, this week, my office manager was like, we're a little bit low on our collections, so, really try to get the financials done before the patients get here. And I was like, awesome, she's reminding me because she's aware. So that was really great. And other improvements that we've made as far as billing and finding errors and things that we were doing that, without even adding the medical yet, we've already been able to have our best month double where I was, and we haven't even added all the things that we're going to be able to do in the future. So that has been excellent. We did a Groupon recently, and we did one prior to, and I had a few new patients from it, but by implementing like a better phone script, we've had, at least like a 60% get a chiropractic exam, and then probably at least 40% that did x-rays. And so it's added a lot to our new patients over the last month because we took a different approach with that was really easy.
That's incredible. And in what period of time did you double your collections?
I think it was like, 4 months?
Wow, yeah. That's awesome.
Yeah.
And
yeah.
How has it been like managing with your staff and having the right staff all on the same page?
It's been great, and we made some staff changes. So there's definitely been some transition, but I think it was all transition that needed to happen. So they helped me transition a new chiropractor in who's excited about the opportunity. They helped me kind of have that confidence and strength to move forward and find someone who's going to fit and be excited to be working here and have that opportunity. So that was a really positive change, and having my office manager be rewarded differently and have like more ownership of her job and her position and better training. And we're getting ready to hire someone else, and she's going to be a really big part of that hiring process. So I feel like she is getting empowered as well with the new systems that we've put in place.
That's incredible. Mm-hmm. And coming from a straight chiropractic background, how has it working philosophically into an integrated model where you're having medical doctors and chiropractors, and how has that been, and how are you able to work with that coming from that?
It's been awesome. I mean, I think the cool thing was, as long as, and we were very open about this, and I think when you find the medical doctor, that was really helpful too, because it was like, we don't want, these kind of drugs or this, like our goal is this, and we were very upfront with it. And he's excited about the possibility of what he's going to get to learn and the proactiveness of the patients, as opposed to like, give me a drug and that's just all he gets to do. Like so he's excited to learn and be a part of something that's a little bit more holistic. But as I've talked to my patients about it, they're so excited and they're like, that's awesome, and they're impressed. I have not had one say like, oh, why are you bringing a medical doctor on? They're the enemy or something like that. They've only said, wow, that's cool. And what is that? Maybe they might say, why are you doing that? And I'd say, well, we're going to be able to do so many more services. We're going to be able to do allergy testing, and we're going to be able to do these great medical food prescriptions that are going to be covered by insurance, so it's not so much out of pocket all the time. And they're like, oh, and so they're excited, and they're, it's been a little bit of a process just to get all of the ducks in a row to have him join, but I feel like as we've been talking to the patients, like that anticipation is great, and I don't think it's going to be difficult to fill a schedule.
That's incredible. Mm-hmm. And as a chiropractor, how do you feel about integrating a medical and chiropractic practice, and how that is as far as the future of health?
I think it's really smart, I feel like we've been kind of outside, and that's our doing and their doing, but like every medical doctor that I've got to meet or that I've shown my practice has always been impressed with what we do. And I think the more we can integrate into their system, the less we're going to have to worry about the future of where our healthcare and our billing and our everything is going to be, because we're getting into that model. So I feel like it's a win-win, because they get more proactive and more preventative health things that they don't currently know how to do or do. And we get, some extra expertise, some people that can help taper people off their medications safely. And, the help with the billing and the collections, and the ability to be able to have patients get a lot of different services without having a ton have to come out of their pocket. I think, as you've seen with like Massage Envy, that has like changed massage completely, right? And more people are getting massage regularly, and it is, it's, for better or worse, it has changed massage and brought it to the forefront. And I think having that safe brand that people are used to, and they understand what they're going to get, I'm excited to see where that goes. Obviously, this is new, but I think if you look at the marketplace and what has worked, even in healthcare things, I think it'll work. I'm excited to be a part of it.
Awesome. Well, you're doing very, very well. We're very proud of you, and it's an honor to have you part of our franchise.
Thank you.